Now, to dig a little bit deeper into these therapeutic approaches, some of the more common therapies that are being investigated today are what are known as anti-inflammatories. This is basically the category that Restasis falls under. It helps with the localized inflammation in the eye, and that may be presented by corneal staining, redness of the eye, lack of tear production because the glands that produce tear may be infiltrated and not functioning properly. So there's a lot of other agents that are being looked at in this category of anti-inflammatory, and we'll walk through each one of those in just a moment. Additionally, there's hormonal therapy, so topical androgens to the surface of the eye and along the lid margin to help with the regulation and secretion of lipid and meibum. Secretagogues. This is a category that sounds just like what it is. It secretes more tear, and it can secrete different types of tear. These medications hopefully upregulate mucin, and that's that lowest portion of the tear that helps the tear stick to the eye and spread over the eye. It may help with secretion of lipid, and it may also help with secretion of aqueous. So there's a lot of agents being looked at as mucin secretagogues. Anti-evaporatives, so these are agents that hopefully keep the tear from evaporating off the surface of the eye. Nutritional supplements. Dr. Evans spent a lot of time reviewing the omega-3s and the different pathways and how this can be beneficial to patients. We've seen in our clinic that it's very effective for symptomatology. There's been some struggles in showing how it affects clinical signs, but we see that the patients feel much better. Mucomimetics, these are synthetic mucins that are being produced that we're studying, and then improved polymers. I think there's been a lot of discussion, especially from the patient panel, that artificial tears may not be that helpful. They've tried a number of different types, and at the end of the day, it really just doesn't provide the relief that you're looking for. Well, there's a new generation of polymers that are being investigated, and these are ingredients that are not on what's called the monograph. The monograph is a pre-approved list of ingredients that the FDA said you can mix up these ingredients and create artificial tears, and you don't have to go through a lengthy regulatory process. But there are newer polymers that we think will be more effective that we're trying to add to the list and we're investigating today.